The Congressional Budget Office says if it becomes law, the American Health Care Act would cut the deficit by almost $120 billion over the next decade. But it would also leave 23 million more people uninsured. For now, Governor Chris Sununu's wait-and-see position on the bill remains unchanged.
I think people know that I have not been very thrilled with the bill that came out of the House, and I have faith in the Senate that they're going to keep working on it, keep making sure that we provide coverage and we provide affordable, quality coverage that people can really count on here in the Granite State.
The New Hampshire Hospital Association is less optimistic.
I think the CBO score really reinforces our concerns about the American Health Care Act in that millions of Americans would continue to lose health insurance coverage, including tens of thousands of Granite Staters.
The CBO says the Republican health care bill would destabilize some state health insurance markets. Medicaid would face more than $880 billion in cuts, which the Hospital Association says would downshift costs to the states. But the Senate is expected to do major surgery on the AHCA, essentially writing its own version of the bill. Right now, it's not clear how the House bill would affect the number of insured in New Hampshire, but once the Senate version is made public, Governor Sununu says he will take a position on it.
Hopefully it works, and if it doesn't, people are going to hear that it doesn't. I'm never too shy to let people know where we stand and what we need here in the state of New Hampshire.
The governor isn't saying specifically what would move him in the direction of support or opposition, but a top aide says this all comes down to money, the funding that would return to New Hampshire under a block grant system. In Concord, Adam Sexton, WMUR News 9.